16 weeks pregnant. Fetal development. The mother and the problems. 16 weeks pregnant. What to expect? It's been 16 weeks into your pregnancy and you don't really know what to expect. What is happening to the baby inside you? What are some of the problems that you might face? And so on. This article is perfect for you because it lists out everything that you can expect when you are 16 weeks pregnant. It'll take you through some key issues like why certain things happen to you during this time or what are the common problems that you might face in this phase. Fetal development. This is one of the main things that mothers-to-be are interested in knowing about. What is happening to the baby inside? How is it growing? What are the pregnancy symptoms that are showing, and how much can the baby do inside the womb? The fetal development of the baby at 16 weeks goes something like this. At this stage the baby weighs about 3.5 ounces and is 4.5 inches long. The baby begins to develop fat cells under the translucent skin. The heart strengthens to pump about 6 gallons of blood every day. The heart beats faster than the mother because it has to circulate blood throughout the body and help in the development of the organs. The baby can now blink, suck, and swallow, along with carrying out certain other reflexes. The scalp has begun to develop where the hair will be formed later. The baby begins to breathe on its own at this stage as the lungs develop. The baby breathes in the amniotic fluid and swallows it, in practice for the day when it can breathe on its own. As the lungs develop, the urinary tract also develops to dispel the stuff that is swallowed. The head is more erect. Its eyes have moved to the front of the head. The legs have become further developed. The ears are also beginning to take their final shape. Toenails have started to grow as well. The baby can hear external voices. It can also sleep and dream. Certain facial expressions like squinting and frowning also develop. The baby can perform certain other actions like kicking, grasping, and somersaulting. Eyelashes and eyebrows have also developed. The mother and the problems. Here are some of the key problems that mothers-to-be might face during pregnancy. There might be traces of nasal congestion and nosebleeds. There may be an increase in your blood pressure, causing it to overdrive into high blood pressure. There will be those certain instances of back pains and aches that you'll be trying to deal with. You're more prone to losing your balance at this stage. Many women experience constipation during this stage. This happens because the growing uterus puts pressure on the bowels, thus blocking normal movements. There is severe tenderness and enlargement in the breasts that is noticed. This happens because there is excess blood being sent in that direction for the development of milk. Varicose veins also develop in many women at this stage. This might happen due to sudden weight gain. There might be an increase in the vaginal discharge as well. This is, in fact, healthy for your body, though it might cause irritation. Wash it off with water, but do not try to clean it with scented tissues and wipes. 16 weeks pregnant and not showing? Do not worry. While some women begin to show early on in their pregnancy, some do not even show till 22 weeks. So just relax and you'll begin to show soon enough. Many women complain of cramps when closing in on the 16-week mark. This happens because of the increase of gas in the body. There is a lot of pressure being put on the stomach, digestive health, and the bowels, a combination of which can lead to cramping. Having an understanding of the kind of things that you can expect when you have reached the 16th week mark, will have helped you understand what to expect, and you can be better prepared for what's in store. Don't worry about things too much and try to be happy at all times. This will ensure that you have a safe and happy pregnancy.